Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
And welcome to Doctor's House Call. I'm your host, Chuck in the morning, Chuck Holland. Who am I anyway? And I'd like to welcome, of course, Dr. Weyrich to the show. Good afternoon, Dr. Weyrich. Good to see you.
Yes, good to be here.
Yeah, so, I'm sitting in for Mike, and, we'll try to get through this thing as best as we can for Mike. Well, it's good seeing you anyway, and tell us, how's Dr. Gear doing?
Well, he continues to rehab in Paradise Valley, at his family home there, and I personally haven't talked with him in the past week, but our office manager's been in continual contact with him. So
good.
That's all I can report right now, but he may be monitoring the show for all I know and may choose to call in.
Oh, well, fantastic. All right. Well, let's get started. What you got for us?
On the agenda for tonight, I have a number of different topics. You and your spine. We're going to talk about foot pain related to back problems or back problems related to foot problems. It goes both ways. And then we're going to have a segment of What is Truth, where we look at critical thinking as it applies to science and medicine. And we're going to talk about unsettled science, evidence-based medicine, and then some people from history, Lysenko, Galileo, and the Emperor.
All right.
And we're going to follow up on last week's show a little bit, COVID updates and Medicare updates.
Okay, yeah.
We're going to continue our discussion of the safe use of cortisol. And then a new feature on the show. Last week we had two callers on the subjects of Crohn's disease and high platelets, and I'm going to try on every show to have a more in-depth response to last week's callers, so that I can fill in a little bit more of after thinking things over and have
doing
better answers.
Research
and,
have
better answers.
Fantastic. All right.
And so callers are welcome to call in, and especially at the end of each segment, it would be a really great time for somebody to call in and either talk about today's show, a previous show, or anything else related to medicine that's on your mind.
All right. Perfect.
And by the way, there is also my website, drweyrich.com, drweyrich.com, and that website has been recently upgraded. And if you go to it now, you will be able to see some graphic materials that I prepared for tonight's show. Just go to the multimedia archive, which should be obvious from reading the top of the home page, and choose today's date. And
fantastic.
There will be links to various articles.
Look at that.
And graphics.
All right. Beautiful. All right.
So we're trying to make this as interactive as possible.
Exactly.
Okay.
All right. Let's get to it.
You and your spine. Okay. Foot pain and back pain. I had a patient come in the other day. He was a walk-in, meaning he hadn't scheduled an appointment or anything, wasn't an established patient. I met him for the first time, and he had a complaint of foot pain that caused him to walk with a limp, and he'd been doing this for several months, and he had been seeing a foot doctor, a podiatrist, and wasn't making any progress. So I did an evaluation, and I said, I don't think the problem is in your spine or in your foot. I think it might be actually coming from your spine. And so I looked at the spine, did some orthopedic tests, and decided with his agreement to do spinal manipulation. And after a brief period of manipulation, he exclaimed that his pain was gone. He got up off the table, walked around, and said, "My limp is gone."
Wow.
So He may be back because usually problems that have been active for a while require more than one treatment to get long-term relief. But best he'd felt in months.
How about that? Wow.
So I'm really proud of that kind of report when I get that kind of report.
Yeah, exactly. Huh. And, the podiatrist just absolutely couldn't really see the forest for the trees, I guess.
Well, I don't know the podiatrist. I don't want to put any names out or anything. But sometimes there's an old saying that if all you have is a hammer, every problem looks like a nail.
I'll have to remember that one. That's a good one.
So I'm a naturopath, and part of my training is total systems training, treat the whole body.
Right.
To a cardiologist, you tend to be a walking heart, and to a pulmonologist, you're a walking lung, and so on and so forth.
Yeah.
But I am trained to look at the whole picture.
Right, and that was his area of expertise, therefore he was focusing on that.
Right.
So.
But more to the problem, the body has, from the feet to the head, what's called a kinetic chain. You have your foot, which has arches, and foot has joints in it. You have ankle joints, you have knee joints, you have hip joints. Then you go into the spine, and you have a series of joints in the different levels of the spine. And then your head is balanced on top of the spine. And a problem in any one of those joints can throw off everything else. So if you've got a foot problem, especially if it makes you walk with a limp, then it torques your knee, it torques your hip, torques your spine, and your spine tends to get an S shape to it, and your head might sit cattywampus. And overall, all of that stresses the body and can cause pain generators anywhere from the bottom of your feet up to the top of your head. And so if there's pain in the foot, maybe it is a problem with the foot.
Right.
But it could be coming from the hips being misaligned. In the case of this patient, it was actually a hip problem, that his hips were twisted. And I knew that his hips were twisted because when I looked at his leg length, one leg was longer than the other.
Oh, my.
And some people are born that way.
Yeah.
Some people acquire that after, for example, hip surgery. Sometimes the surgeon doesn't quite get the hip matching in length to the original, and so the surgeon can introduce a short leg. But many times a short leg is what we call a functional short leg, which means that there's nothing physically wrong with it, but the hips are twisted, and because the hips are twisted, then one leg appears shorter than the other. And
Interesting.
The treatment for that is to untwist the hip. And I do that typically using what's called a drop table, where I position the patient on the table, usually face down, and apply a rapid shove, if you will, a thrust, as it's more professionally called, to a particular portion of the hip. And when I apply a modest amount of pressure, or moderate amount of pressure, the table spring latch drops, and the table drops about 1/4 of an inch. And that is a high velocity, low amplitude. It's moving over 1/4 of an inch thrust that moves the bones. And it's relatively painless and not as scary as some techniques. Some of the techniques can be quite intense. I try to avoid those, but some patients really enjoy being put on their side and having their whole body twisted with the leg sticking out as a lever.
Right.
That works for some people, and I'm trained to do that, and I'll do it when necessary on smaller patients. Not as big as Dr. Gear, so I don't take on the larger patients that he would take on. And there's also a bear hug that Dr. Gear is very fond of, and it's my favorite treatment from Dr. Gear. It's actually called the anterior thoracic movement or method, and it is a bear hug, and it's kind of claustrophobic for me, but I know that's what my spine wants, and so I get it done from time to time.
Interesting.
And then instead, I tend to use the trop table again, putting my hand, or actually my thumb in most cases, on a particular rib or vertebra that needs to be moved, and using the drop mechanism again with a relatively gentle thrust. And so I have different techniques in Dr. Gear, but generally patients walk away happy. And then for the neck, Dr. Gear often does something that looks like he's going to twist your neck off, like you're a chicken or something. Not to disparage what he does, it's very effective. But again, some patients get nervous when people grab their neck and head and start twisting. But again, it's very effective. For the neck, I tend to use what's called the activator technique, which is a small instrument, spring-loaded instrument that, again, applies a high-velocity, low-amplitude thrust to wherever I have affixed the instrument to the patient's neck or skull. And it gets good results as well. And it's less scary.
Right.
So that's
different techniques, same results. Well, basically.
Yes, and there's other techniques out there that Dr. Gear nor I practice. So there's lots of different techniques, and I need to say I'm not a chiropractor by license. I am a naturopath. Naturopaths are fully trained and licensed to manipulate the spine just like chiropractors are. And so some naturopaths do, and some naturopaths take other specialties, but I'm trained in it. Been working under Dr. Gear, both he is my teacher and as my senior colleague since 2005. He was my teacher for 2 years. I did clinical rotations in his office while I was still a medical student.
I see.
And I've also been trained by one of his students.
Oh, wow.
So, long history of doing the kinds of things that Dr. Gear does.
Right. Well, you've certainly been trained by the best, that's for sure. Yeah, Dr. Gear is, he's a legend.
And which brings me to another topic, going back to the feet again. A lot of people do have problems with their feet that can cause a chain reaction up the body. If your feet aren't right, then your knees may not be right, and your hip may not be right, and your spine may not be right, and so on. So sometimes custom orthotics that are made for your feet after using a machine that scans your feet, determines where the pressure points are, determines whether your foot is turned in or turned out, and then we send that by computer to a laboratory. I'm not sure where the laboratory is. I think Florida, but it doesn't make any difference. It goes out over the internet to the laboratory, and they make custom foot inserts, or they can make custom sandals or custom flip-flops, all specially made for your particular foot to help balance your stance so that it relieves the knee pain and hip pain and so forth. And if you come into our office, we will give a free evaluation of your feet. Takes less than 15 minutes, and we offer a free evaluation to anyone who wants an evaluation. A 15-minute consultation. Come in, bring your x-rays if you have back problems. If you have internal medicine problems, bring your lab reports, and I'll be happy to look things over, talk to you about how I think I might be able to help you, and no charge. But you'll have the opportunity to say, yes, I want to proceed with pay for further evaluation and treatment, but that's your option.
So what if you want to get an evaluation and you don't have lab work or you don't have x-rays? What can you do for that?
Well, you come in and I take a brief history, and that's what we do.
Okay. Outstanding.
The next segment, what is truth? Evidence-based medicine. Okay, so we hear a lot about science says this and science says that, and if you don't believe this, then you don't believe in science. But science is very sophisticated, and it has a number of different levels of evidence. In other words, sometimes the evidence is kind of weak, and we say, maybe that's okay. Other times, we've got really, really, really great information. And if you look at my website there is a graphic of levels of evidence. Mm-hmm. And it looks like a pyramid. And there's a number of different renditions of this on the internet. Many different textbooks have slightly different ideas, but the general idea is the most reliable information comes from what are called systematic reviews or meta-analysis, and these are examples of where an analysis is made of, for example, I want to do a systematic review of treatments for, say, Crohn's disease. So I go to a database called PubMed, which is the National Library of Medicine, operated by our U.S. government, that indexes peer-reviewed literature, scientific literature in medicine. And so I say, I'm going to go to PubMed and look at all research on Crohn's disease that has been published from 1975 to the year 2000 that's published in English. And I'm going to get a list of all of those articles and all of the ones that describe whatever criteria I decide. I'm going to read through and compare results. And in the case of meta-analysis, I'm going to do a statistical analysis to try to come up with what the most likely conclusion is, because in most areas of science, all the papers don't quite agree. Some say it really is helpful, a treatment. Others say not so much. And so we're looking for what's the best current understanding of what is true. Mm-hmm. So that's the best, the systematic reviews. Next best is what's called a randomized control trial. And this is where we sit down and we take a group of people and divide them into two groups. One group is called the control group, and the other group is the test group or the treatment group. And so the control group, we in effect give them a sugar pill, which that is some treatment that we don't expect will benefit them or harm them. Mm-hmm. And the other group, we do a treatment that we're interested in. And so the question is the control group different in their response than the treatment group? Mm-hmm. And we use statistical tests to evaluate how likely it is that the two groups actually are different in their response. Because statistically, we've talked about before, if you throw 100 pennies up in the air, chances are they're not going to land 50 heads, 50 tails. It'll be close, but not quite. And so if we're trying to decide whether or not the pennies are loaded or fair or not, then there's statistical tests that let us say we're 95% sure that these pennies are fair, or we're 50% sure that the pennies are fair, or whatever. And so with the randomized control trials, we have the two groups, one that gets a treatment, the other that gets a placebo treatment, a sugar pill treatment. And in the best case, it's a double-blind study so that the patient doesn't know which group they're in, and the doctor doesn't know which group they're in. There's some third party that decides which treatment each patient gets, and nobody knows in advance. So I've participated in research studies like that, and so I got a box of the treatment drug, and each box had a number on it. And so I gave the box to the patients, the study participants, and they took it as directed, and I evaluated the results. All I knew is they had a certain number. I didn't know what was in the box, and the patient didn't know what was in the box. And that's the best kind of single study you can do. Underneath that, less reliable than a double-blind randomized control trial is a cohort study. And the most famous of those is the Framingham study in Framingham, Massachusetts, where they basically enrolled the whole town in a study that looked at just evaluated their lifestyle and so forth, and looked at what diseases they developed over decades. And so that's a cohort study. And it's useful, but it isn't considered to be as strong of an evidence as what I've talked about previously. Mm-hmm. Next comes case reports, where I treat a patient and with a particular treatment, and the patient gets better or the patient gets worse. There's some notable outcome that I just noticed with this one patient. Maybe I've never seen, or maybe I was using a combination of treatments that most doctors don't use together, and the patient does better or does worse than the typical expectation for the patient. I write up a case report, and it's one piece of evidence, but it's considered what's called anecdotal evidence. That means it's just a case. It's not a systematic study of a number of individuals. So it has some weight. And if the case report sounds interesting, then a researcher somewhere will apply for a grant to study it further with a randomized control trial, or even just a case series where if I like the results of this patient, I look for other patients with a similar condition and treat them the same way. And if they also do better, it's not formal proof that I've got a really good treatment, but it's suggestive. And the more patients are in the case series, the more convincing it is. Okay. So those are the most reliable methods. Next, below that, is called expert opinion. And so a lot of people say if the expert is a scientist, their opinion must be science.
Right.
And I'm sure you can think of some experts.
Yeah, everyone's an expert in something.
Yeah, there's one definition of an expert is that he's any consultant that's more than 100 miles from home.
Right. Exactly.
But there are some very prominent experts, some of which have won Nobel Prizes, but they're just expert opinions.
Right, and it's just that. It's an opinion.
Right.
Right.
But even the expert opinions are ranked higher by most scientists than animal research and in vitro studies. So those are the lowest level of proof. So if I treat a rat in a certain way and the rat responds in a certain way, can I assume that people will respond the same way? Maybe, maybe not.
Maybe not, yeah.
And so animal research is suggestive, but it's not really very conclusive when it comes to treating people. Mm-hmm. And the least reliable of all is what's called an in vitro study, where instead of, for example, testing an antibiotic by seeing whether it cures an infection in a person, you put some of the bacteria in a petri dish and you apply the antibiotic to the bacteria in the petri dish, and you see what happens. And so again, if nothing happens, then probably the antibiotic doesn't work very well. But if it's a great antibiotic in the Petri dish, that doesn't necessarily mean that it's going to be great when you take it orally, for example.
In the human body, yeah.
So those are all the different levels of science. But there's more. There's a lot of people running around, especially the experts, saying, this is settled science. Stop contradicting me. Don't ask any questions. It's settled science. Well, I'm going here to tell you that there's no such thing as settled science.
I was almost going to say the same thing. It's like, I don't think that's a good way to go.
Yeah, and I have examples. At one time, it was settled science, at least to the satisfaction of the church, that the earth was the center of the universe and everything moved around the earth. Mm-hmm. And that idea was contradicted by a scientist by the name of Copernicus, who died before the church had any reaction to it. But then Galileo came along and started talking the same thing. And he came very close in the Inquisition to getting burned, and he died in house arrest because he wouldn't recant that he thought that the earth rotated around the sun. Mm-hmm. So eventually people actually came to, and even the church came to agree that Galileo was right. But Galileo wasn't right either. Actually, the Earth and the Sun rotate around a point in space that is between the Earth and the Sun. It's close to the Sun because the Sun is heavier, but it's not quite the same thing. Earth isn't rotating around the Sun. Earth is rotating around a point close to the Sun. And even that's not the true story, because all the other planets affect the rotation of the Earth and the Sun, and so the whole solar system is rotating around a point that's the balance point between all the different planets.
Right.
And so going even further, I'll say that they're all right, because it's really what's called a frame of reference question. Mm-hmm. You pick one point as being your center, and by mathematical transformations, you can describe the motion of all other bodies in the universe relative to that point.
Right.
So the sun is a much more convenient point of reference than a point somewhere in space, and definitely a lot better point of reference than the Earth. But the whole solar system is not anywhere near the center of the universe.
Exactly. Yeah, that's true, and it's all dependent on other planetary figures and bodies and their gravitational fields.
Right.
And that affects everything.
Yes, and an interesting side note on this is the planet Pluto was discovered because scientists did calculations of how the 8 planets should be rotating around the sun, and the calculations weren't, there was discrepancies from what they measured. Mm-hmm. And they said, that's peculiar. And they did some additional calculations, and said the explanation of why these planets aren't moving the way we expect is there's another planet out there that we don't know, but they figured out where to look and how big it had to be. And bingo, there was Pluto.
Right. So
science is always evolving. And I could go on with other examples, but in the interest of time, let's just, one more example. Newton made laws of motion. For every action, there's an equal and opposite reaction, so forth. And there are also laws of thermodynamics. And one of the laws is energy is conserved. The energy in the universe, total amount of energy in the universe, never changes, was the thought. Mm-hmm. It just changes form. And total mass of the universe doesn't change. It just changes form. That was the theory. And it was a law for a long time. And then this fellow by the name of Albert Einstein came along with his famous equation, E equals mc squared. Energy is equal to the speed of light times the speed of light times, or the mass of something times the speed of light squared.
Right.
And suddenly, that says, in effect, you can take mass and convert it into energy. So the amount of mass in the universe is not constant. The amount of energy is not constant either. Mm-hmm. And that's the basis of the atomic bomb.
Right.
And so now, everybody, that's settled science. But other examples, the history of washing your hands during surgery was very controversial, and for a very long time, surgeons didn't believe that there was such a thing as germs, and women died of puerperal fever after childbirth in many cases because of unsanitary conditions under which they were delivered. And that problem pretty much went away when the old scientists died off and the new scientists came in and said, yeah, there is something to this germ theory. Mm-hmm. Okay.
Interesting.
So I'm almost done with this topic, but let's talk about Lysenko. Lysenko was a Soviet scientist, a botanist, a geneticist, or he advised the Soviet government, Stalin, on how to improve crop yields. Mm-hmm. And he had some very strange ideas that were out of step with the rest of the world's understanding of plant genetics. And for political reasons, Stalin really liked what Lysenko had to say. And it became the doctrine in the Soviet Union. Lysenko knows how to plant crops, listen to him, and ignore the geneticists and so forth. And there were thousands of scientists in the Soviet Union who were actually executed because they spoke out against Lysenko and Lysenko's theories that were endorsed by Stalin.
Whoops.
And so be very careful when the government starts talking about settled science. Mm-hmm. Make sure it's not politics talking instead of science.
Right.
And there's one last person that I want to mention here, and that is the creator of Jurassic Park. You know who did Jurassic Park? It was a director and author by the name of Michael Crichton.
Right.
And he was a medical doctor and also an anthropologist. He was educated and taught at Harvard.
Oh, I didn't know that.
No dummy.
Wow.
So Jurassic Park actually has a lot of science behind it. It's not just some fiction writer. Mm-hmm. He put a lot of science into it. And he was very, very emphatic about some things. And one of the things he said, and this is in an essay that I linked to on the internet, aliens cause global warming. He says, the work of science has nothing whatever to do with consensus. Consensus is the business of politics. In science, consensus is irrelevant. What is relevant is reproducible results. The greatest scientists in history are great precisely because they broke with the consensus. There is no such thing as consensus science. If it's consensus, it isn't science. If it's science, it isn't consensus, period. Mm-hmm. And he goes on to give a lot of examples.
Right.
But consensus is another word for expert opinion.
Right.
So, almost done with this segment. So I'm going to tie the knot with a children's story. Do you remember the Emperor's New Clothes?
Yeah, it rings a bell. Yeah. So
the shorthand story is an emperor was very vain and wanted new clothes, and some shady tailors convinced him that they had this magic cloth that would help him determine who was loyal to him and who wasn't. they said that this is a beautiful robe, but only the most worthy can see it. And so the emperor, when he was fitted out with this thing, he couldn't see it, but he dare not say that because he'd be admitting that he was unworthy.
Right.
And so he goes parading down the street in his clothes that nobody could see.
Right.
And everybody was afraid to confront the emperor with, "You don't have any clothes on," except one little child that broke the bubble. So that's, nutshell, emperor's new clothes. And so that was consensus, forced consensus for fear of political retribution.
Yeah.
So I've said enough on this subject.
Interesting.
Okay, so where are we?
What's new in medicine?
COVID. Okay, so I talked last time about a new COVID pill that the FDA was considering. Mm-hmm. They approved it with certain concerns, and now the CDC has to approve it, but it's on its way, so that's new. I talked about Medicare last time, and I talked about Medicare Advantage programs.
Right.
And
all over the TV.
Yeah, and I warned patients that some of the Medicare Advantage programs were really HMOs, which means that you have to go to the insurance company's doctors. And if there's no doctor in Payson, you might find yourself going to Phoenix for some specialist. We have a specialist up here, but he's not on the plan necessarily. And it's hard to get chiropractors from these HMOs. Mm-hmm. But there is also a PPO, which is a preferred provider organization, where if you go to the insurance company's doctors, they pay more of the cost, but if you go to someone else, you have to pay part.
Right.
So that's those are the Medicare Advantage. So it asks very, very pointed questions about whether your favorite doctors are on their list. Mm-hmm. And at this point, it's a moot issue for another year because, as I understand it, the enrollment period ended yesterday.
Today.
Yeah. Okay. So, moving on. Safe use of cortisol. So we got into a lot of interesting discussion about cortisol, but I didn't get to my bottom line, which was the human body makes about 40 milligrams of cortisol a day under normal conditions. Sometimes the body doesn't make what it needs. And some doctors prescribe very high doses of prednisone, much more than the body would make naturally. And this has sometimes unwanted side effects, and it can be dangerous if not done correctly. I, as a naturopath, will prescribe maybe 20 milligrams of cortisol if a patient is needing a little bit of help. Now, 20 milligrams, that's half of what the body should usually be making. So it doesn't have any serious side effects. It's all benefit and no real risk. But if you go to the pharmacy and fill my prescription, the pharmacist will give you a list of information about corticosteroids. One list for description for all corticosteroids, whether it's 5 milligrams of cortisol, which I have prescribed a day, or 50 milligrams of prednisone, which another doctor has prescribed a day. Same handout, same scary side effects. So I just wanted to set the record straight that low-dose cortisol isn't scary, and there's an entire book written with the title, The Safe Use of Cortisol, and it goes into great detail about how to prescribe cortisol safely. Okay, so last week we had a caller interested in Crohn's disease, and I basically said we were very short on time, just called in just before the end of the hour, and said, yeah, I do that. I treat that. And so I wanted to go through a list of things that are naturopathic that are in addition to what most of the medical doctors would tend to do. So first on my list is an IgG food sensitivity avoidance diet. So there's a test that we do in our office. Dr. Gear's talked about it many times, the IgG food allergy test. And Crohn's disease and ulcerative colitis are inflammations of the gut that can be irritated by eating the wrong foods. What are the wrong foods? I don't know until I run the test, because everybody has a different list of foods that their individual body is sensitive to. So anybody that has any kind of gut inflammation, I always want to run the IgG test on them. There's another thing that is very strongly related with inflammatory bowel disease, including Crohn's disease and ulcerative colitis, is probiotics. The bacteria in the gut can be good or it can be bad. It can be irritating to the gut or not irritating to the gut. And there's considerable evidence, some of which I've included on my webpage. If you follow the link to my webpage for Crohn's disease and ulcerative colitis, everything that I'm telling you is on the webpage there and more. So introducing the proper probiotics, proper bacteria into the gut often benefits Crohn's disease and ulcerative colitis and other inflammatory bowel diseases. And then there's one that I don't do personally, but is a research topic now, and that is fecal material transplant, which means you take fecal material from a healthy patient and you introduce it into the gut of a patient that has inflammatory bowel disease.
Wow. And
it's just a variation on probiotics.
Oh, okay. Yeah.
But it's restores certain bacteria that are hard to get from the oral probiotics. So it's a research topic right now, but it is being used and it does give good results.
Interesting.
Another treatment which I do is called low-dose naltrexone. And we've talked briefly about low-dose naltrexone before. In other contexts, it tends to treat autoimmune diseases and inflammatory conditions, especially neuroinflammatory conditions. But it has been shown in case studies that it benefits inflammatory bowel disease. And it's an inexpensive and very safe medication I can prescribe. I would prescribe it what's called off-label, so I have to give you informed consent, but it's effective, seems to be effective based on case studies, and it is not expensive. So I highly recommend giving that a try if you are suffering from inflammatory bowel disease of any kind. And then there's immune system balancing, because anytime you have inflammation in the gut or anywhere else in the body, that means that the immune system is busy. And sometimes the immune system works well, sometimes it's our own worst enemy. And that's the case when we have autoimmune diseases. Many of the most serious COVID cases are due to the immune system not working properly and causing what's called a cytokine storm, where the immune system basically is overreacting and harming the body by its overreaction. So there are ways to help balance the immune system. And hormone balancing, it's been found that certain kinds of estrogen actually benefit inflammatory bowel disease, whereas other kinds of estrogen are harmful to the gastrointestinal tract. And so proper balancing of hormones can benefit inflammatory bowel diseases. Neurotransmitter balancing is also sometimes used, and so that's basically the overview of the things that come to my mind naturopathically when talking about treating all kinds of inflammatory bowel disease. And I have a lot more information on the website on each of these topics, including references in many cases to the peer-reviewed literature. The other caller that called in had what she described as high platelet count. And I said a little bit about that, but didn't really have enough information to be very helpful to her because there are many, many different kinds of causes of high platelet count. And before talking about treatment, we need to figure out which cause is at play because the treatments are all different. And so the first step in treatment is not to talk about how to get rid of high platelet count. I can think of a lot of ways of doing that, some of which are appropriate for some patients and some are not. The real thing that you need to do is think more in depth what's causing
What is the cause?
And so what we do is what's called a differential diagnosis. Now, a differential diagnosis means take the symptoms that are presenting and list out all the different medical causes of each of those symptoms. And then doctor looks at the list and says, oh, this is a dangerous condition, we'd better test for that. And this is a common condition, we should test for that. And
what are some of the symptoms of high platelets?
The worst symptom is stroke or other organ failure because high platelet count is associated with increased clotting. So anything that could have to do with more clotting than you want, think blood clots causing blockage to the heart arteries in the heart or blockage to arteries in the kidney, arteries in the intestines, arteries in the brain. So symptoms can be similar to a transient ischemic attack. So the good news is if you get a regular medical exam and your doctor follows standard practice, you'll have a complete blood count. And that will tell what your platelets are doing, whether you have a high platelet count or not. And if it is high, then game on. It's time for the differential diagnosis and testing.
Okay.
But some of the differential diagnoses are, it could be genetic, which is rare. It could be an idiopathic bone marrow problem where the bone marrow makes too many platelets. And idiopathic means we don't know why. It's also called primary high platelet count. But there are a couple of very special words rather than saying high platelet count. The doctors like to talk about thrombocythemia or thrombocytosis. Really big words.
Right.
Easier to say primary high platelet count or secondary.
Right.
Primary means we don't know what is causing it. Secondary is we've found some other reason.
Right. That would be the English version.
Yes.
Yeah.
So some of the secondary causes on differential diagnosis, a very dangerous one that you definitely want to rule out is cancer. One of the first signs of many cancers before you have any other symptoms is your platelet count goes up. And so if you have a high platelet count, definitely need to rule out cancer. Blood loss or anemia. And anemia could be due to a number of different kinds of nutritional deficiencies. Some pharmaceutical drugs can cause high platelet count. If you have had your spleen cut out surgically, perhaps because you were in an automobile accident and your spleen ruptured,
right,
and you'll bleed to death if they don't cut the spleen out and seal the wound, because the spleen is very difficult to sew back together. It's not something you can easily stitch up. So a lot of times the spleen has to be taken out. And here's an interesting one. It could be secondary to inflammatory bowel disease, which we were just talking about.
Circle back around, yeah.
Yeah. And that's the case in medicine. There's multiple causes for things, and things can be interrelated. You could have a connective tissue disorder. Could be an infectious disease like tuberculosis. Other causes of inflammation. So again, an IgG test for food sensitivities that might be causing inflammation are appropriate. Mm-hmm. And there are tests directly to see if your body has inflammation. And transitory, if excessive physical activity can raise platelet count, excessive alcohol use can raise platelet count, but those platelet counts tend to go back to normal if you stop doing whatever you were doing. So first step is complete blood count if you want to diagnose platelet count or high platelet count. And then a peripheral blood smear. These are both inexpensive lab tests that SnoraQuest will do. Mm-hmm. And then more invasively is a bone marrow aspiration or biopsy, where they take a needle, drill it into your bone to get a sample of the bone marrow out, and then they look to see if, under microscope, to see if it looks normal or not.
Mm-hmm. That sounds a little uncomfortable.
Yeah, it's not something you want to do unless you're really curious.
Right.
But if you have high platelet count, doctors need to be really curious.
Right.
Unless they can find something simple. So if the patient has anemia, treat the anemia and see if the platelet count normalizes.
Right.
If you go through the list and you didn't find anything, you go back to your list and look at less likely causes, less scary causes.
Yeah.
But it's all done in a systematic way.
Right.
It's about time to close out the show. Let me just close out by reminding everyone that, number one, my web page is drweyrich.com, and the Multimedia Archive in the future will have an outline with supporting materials for the upcoming radio show. Mm-hmm. I'll put that up over the weekend. I won't have it up right away because we're still putting together the next show, but by Monday I will have the agenda for the upcoming radio show.
Perfect.
So you can check that out. And I offer free 15-minute consults for either musculoskeletal issues or internal medicine issues. In a minute, you'll be given our phone number during our close. Call during office hours. Make an appointment for a free consultation. If you have x-rays, bring them in. If you have lab tests, bring them in. If you don't have either, bring yourself in. And we'll sit down and I'll find out what's on your mind. I'll tell you what I think I can do for you, and we'll take it from there.
Figure out what steps to take it from there.
No obligation.
Outstanding. Well, thank you very much, Dr. Weyrich. Once again, it's good to see you, and look forward to our meeting again next week. And take care of yourself. Say hi to Dr. Gear if you talk to him for me.
Okay, will do.
And we'll wrap things up.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.